Here's a figure that will put your blood pressure right up. The Telegraph newspaper reports that the cost of the NHS to every household in the country is £10,000 per year. 10 grand a year per family, let that sink in. I say this with no pleasure, but access to the best private medical insurance would cost you a fraction of that. The government could pay people a grant of half of that figure, say 5 grand, and they would easily find excellent health provision from the likes of Bupa. It doesn't have to be this way, and it shouldn't be this way. But that's the grim reality of the broken health and business model that is the National Health Service. Thousands of people are now using savings or borrowing money that the NHS for services that the NHS say is not urgent, which means that they've paid twice through taxes and again through savings or loans. The NHS risks becoming, like the BBC, a service that everyone has to pay for, but one which millions don't use. And of course, that doesn't end well. Daring to question the sacred cow that is the NHS is politically impossible. And here's the thing. You'll get dagger stares in polite company if you ever criticise this organisation, even though you are the customer and you're paying for it. You're allowed to be critical if it's not delivering, and it's not. Let me stress the doctors, the nurses, the cleaners, the porters, the security staff, they are the best of this country. Talented, hardworking, educated, often underpaid, and of course caring. There are no words, but they exist within a structure that is crumbling. By next year, all income tax revenue will go to the NHS. All income tax revenue. Another stat that should have you reaching for your tranquilizers. At what point do we wake up from the anaesthetic and realise that money is in fact not the answer? Because no matter how much we put in, and Britain is now among the biggest spenders on healthcare in the world, things actually get worse. A new report from the think tank Civitas says that health outcomes in the UK are the bottom of the league among comparable Western countries, with 50,000 people dying every year for want of an effective medical intervention. So what's gone wrong? The painful truth is that as a nation, and I love my country and I love my people, we are not in good health. We eat a load of crap. Some of us drink too much. I've done all of that myself. And we don't take enough exercise. Obesity, type 2 diabetes and heart disease are all lifestyle related. All of them. No one's getting fat or diabetic on a diet of chicken breast, broccoli, salad or boiled eggs. But rather than tackle the root causes of illness, the NHS expensively manage the side effects with endless medications, so many of which don't even make a difference. Leading cardiologist Aseem Malhotra says statins for heart disease, for example, are largely a waste of time, but they cost the NHS millions. And new research this week suggests that antidepressant pills have no discernible effect on mental health. That's billions we spent treating people with medication that have apparently made little or no difference. The drugs don't work. And what about those middle managers on six-figure salaries, the endless bureaucracy, and what about an NHS clearly in the pocket of the pharmaceutical industry? Whenever you go to see your doctor, they never ask how much you're sleeping, what you eat, whether you've had access to sunshine or fresh air, if you drink enough fluids, or whether you move your body. Only the likes of NHS GP Dr. David Unwin, who has reversed the diabetes of scores of his patients and got their weight down, has made a difference. How did he do it? By getting them off bread, sugar, pasta, pizza, potatoes, biscuits, chocolate and beer. In other words, carbohydrates. I know, all the fun stuff. But I cut that stuff out myself and lost 3 stone. Mrs. Dolan says I'm too thin now. All most doctors can think of is what to prescribe next. The NHS is the biggest drug dealer in the world, and it's killing us. The cost of managing lifestyle-related illnesses is growing, with at least 10% of its budget handling type 2 diabetes, an illness that doesn't need to exist. It didn't exist on anything like this scale 50 years ago. It was rare and is now the norm. Even kids are getting type 2 diabetes now. And that's only half the story, because so-called metabolic syndrome, type 2 diabetes, Heart disease and high blood pressure are a gateway to other illnesses: depression, cancer, fatty liver, kidney problems, fatigue, wear and tear on joints, inflammation, and perhaps most worryingly, dementia. Why is this a worry? Because people with dementia require accommodation and around-the-clock care. The young generation that we have now are the least healthy in history, with 30-year-olds getting new knees because they're so fat. Do the math. Right now, about 1 million people in the UK have dementia. What will we do when that figure doubles, triples, or quadruples? Which at this rate it will. It's a ticking time bomb, and eventually the system will fall over. The public health crisis in this country, which is avoidable, not only threatens to bankrupt the NHS, it could potentially bankrupt the nation. And don't forget, a sick population cannot produce a happy society, cannot contribute to the economic growth that pays for all of our public services. And God forbid, if we were invaded by a foreign nation, would we be fit enough to fight? Good luck with that. The NHS is populated by the best people in our country, but it's a colossal money pit. A health service free at the point of need is a deal breaker for me. You don't want to have to show your credit card to paramedics when you've been run over by a car. But how we deliver free at the point of need healthcare is an urgent conversation we have to have. Many commentators will have you believe by questioning how the NHS works, you want to kill it. Not true. The NHS is killing itself. The final nail in the coffin was COVID, when the NHS forgot its core values. For 2.5 years, they shut up shop and ignored every other illness. They ignored first do no harm principles with vaccines for kids and young people that statistically don't need them. And then they sacked staff that didn't want a needle in their arm, even though they complain that they're low in staff numbers. And the NHS became the national COVID service, with GP surgeries literally chained shut and medics sat at home self-isolating because they'd been pinged having been near someone with COVID. Just think of the treatment they were not able to deliver for far worse diseases like cancer, whilst they were sat at home twiddling their thumbs, watching Netflix and grazing on banana bread. Doctors that didn't have COVID symptoms should have worked throughout the pandemic, and we wouldn't have the colossal waiting list, which some fear could reach 12 million. The health service, egged on by health unions, decided to pursue a zero COVID policy, trying to keep this extraordinarily transmissible virus out of hospitals. It failed, and the non-COVID lockdown death toll will likely dwarf that of COVID. And there's evidence that in the end, the NHS failed to preserve public health over the last 2 years. In fact, they did the opposite. So many people have died or will die or have diminished lives due to ignored other health ailments that could have been caught early but weren't. The NHS's obsession with COVID means a young mother at the age of, say, 30 now has to say goodbye to her children because she wasn't able to get that lump checked. The number of people that have written to me in the course of this pandemic, desperate for medical treatment, well, they've always received the same message from the NHS. If it's not COVID, they don't care. The NHS has the best in this country, but as an organisation, it's on life support. It's at death's door. The fat lady isn't just singing, she's in a cab on her way home. The NHS is in the territory of receiving its last rites and a blessing from the priest. The only way it can be saved is by having an honest national conversation about its future. Given that it's so politically untouchable, I'm not sure that will ever happen. It's enough to make you sick.